And they have to be able to do this in a way that protects their master schedules in the overall flow of their schools. But you'll see added signage for entry and exiting and disposal of trash. And then students will not be using pen pads to enter the key account numbers to eliminate that touch point. Mr. Farkas, anything that you'd like to add here related to meal services?
No, we know that. Thank you, Superintendent Davis. But the reality is that the cafeteria is one of our biggest challenges. That's our common space that we have. All the things that we've done are to eliminate as much as we can that possibility of spread. We want to make sure that we limit movement once we're in the cafeteria. As it turns out, as a former principal, most kids come to the cafeteria and sit in the exact same seat they sat in the day before or the week before. They're going to have their assigned areas. That's actually a positive thing now going forward. But the Student Nutrition Services program has worked very hard to make sure that every single person that's in student nutrition is going to be required to wear a mask the entire time. There's going to be plexiglass between the payment stations, like we talked about. There'll be no pen pad that kids used to touch before. So the reality is the interaction between the student nutrition staff and students will be minimal, and we appreciate Superintendent Davis for support of all these changes.
Thank you, Mr. Farkas. In addition to the extracurricular activities, right now we've done a really good job through Mr. Robinson and also Mr. Ayers have put together an athletic task force, and we know we need to do this for extracurricular activities as well overall, because it's more than just athletics that we offer in this within our school district. But overall for athletics, a lot of questions about what's going to happen for the fall. We're going to follow the guidelines for from the Florida High School Athletic Association. They put out guidelines recently that identifies all the protocols that we must be in place related to the implementation of athletics. And this is where they put a maximum of 40 student athletes, at a time that are interacting. They're making certain that we have social distancing at all time must be implemented. We've established a student to coach cohort to limit exposure. That means that students aren't jumping around with different time frames to interact during the summer or different cohorts as they practice. We're trying to limit that exposure to make certain that we can control any undesired behaviors that may come out of that interaction. And then also looking at, locker rooms are just not available and open at this time. We just cannot do it. We know that that's a particular area that could, increase the transition of the infection. Therefore, right now, we will not be creating that offer. And then also, only one restroom will be available. That way that we can have one area that we can continuously clean to be able to protect all of our learners from any particular issue that may arise. When we look at screening and health protocols, as I spoke to earlier, all visitors will have to have a temperature checked in the main office when they come in. Anybody that's over a 100.4, they will not be allowed to enter our building, and that's through collaboration with the health department. And then all school and district staff will be screened as well upon entry. We are not going to temperature check every one of our students. We are asking our parents and guardians to please do pre-screenings and monitors before our young ones and our students and our adolescents come to our schools. Ask them how do they feel, do they have any symptoms, and if they do, please keep them home. And we will work with you related to making certain that you can make up that work along the way, provide that work for you through an e-learning process so that we can continue to help get your learner well earlier so they do not come to school potentially sick and start to expose our educators or any of our students and where this infection may grow legs within our classrooms. So again, our school staff will regularly check with students, just general wellness checks to make sure they feel okay, and then we will actively engage our nurses to be able to help along the way. Mr. McCauley or Ms. Brown, any comments or conversations you want to add to this point?
Thank you, Superintendent Davis. Our nurses are being trained. They will be trained prior to the school year beginning so that they're well aware of all the protocols. We'll be working closely with other healthcare professionals to ensure that we have the latest information around how we should be supporting this COVID and any students that we suspect. One of the things I think that is really important is that we will be isolating students that come in with COVID symptoms and putting them in a separate space, a separate room, from students that come in with typical health issues that may have an abrasion or may have a headache or may have some other symptom that is not one of the symptoms that we're looking for COVID. We will be working very closely, continue to work closely with the Department of Health when it comes to finding out and making sure that we're making the right decisions about students and their participation in school.
Thank you. And this is all protocols that we've been in collaboration with health experts in the Department of Health and with Dr. Holt along the way, and in order to put in place to have the right protocols. So also we look at the big question we've had: what happens if we have a positive COVID case? What happens to what steps are we going to take as an organization? I'm going to let Mr. McCauley explain this pathway along with Ms. Brown if she needs to show the thoughtfulness that we put in and to show all the steps that we will take if we are forced or exposed with a positive COVID case, whether it be through a learner or whether it be through one of our employees.
Thank you, and to the acting chair. This is, like Mr. Fargus referred to the cafeteria as one of his greatest challenges. This is one of our greatest challenges because it is a moving target, and depending on who you speak to get feedback and advice, there might have some subtleties in their responses. But Ms. Brown, Dr. Russ, all of us have just been really going around and trying to create something that would be easy to use. Well, one of the things that we are excited about doing is taking some of our ESSER funds to create a position. As a working title, we've called it the COVID captain. That will not be their official title on our books, but we are going to have somebody that we hire at the district level along with a couple of support staff that can coordinate all of this work when we do get a positive case reported to us. I know you can appreciate there's lots of folks that need to be notified, including Mr. Farkas and his team in terms of the deep cleaning that might have to go into it, decision making around what do we shut down, a classroom, a wing, an entire building, who do we notify in terms of needing to take precautions for isolation. We will make all of those decisions, of course, in conjunction with the Department of Health, because the contact tracing is so important. And from our perspective, we recognize we've got 20, 22, 30 kids in a classroom. The conditions are such from Dr. Holtz and Ms. Brown, I'll defer to her. There are some conditions that they gave us that they look for when someone does test positive. That would be the use of a face covering in that environment, the amount of distance between individuals, how much time those individuals spent together. All of those will play a part in who we ultimately have to advise to take isolation versus not. So we appreciate this is going to be a very, very fluid process as we learn more about it. And then, of course, recognizing the reactions of our families, understandably so, on whether or not they want to send their kid back to school, knowing what has been happening. So it is moving, but we are very, very close to Dr. Holt at the Department of Health and, of course, the T-Pro team guiding us in some of the decisions that we're making, and will ultimately be updated in this document.
Also, the big piece is not only do we identify, what steps we take as an organization when we have an employee or when we have one of our students that are found tested positive for COVID, but it's about what we're going to do for contact tracing. This is a major piece that we have to be able to take, steps that we have to be able to take in order to start the process to actively engage and track down where this actually originated. We have an awesome team. I know that Safety and Security with Mr. Culpepper is ready and primed to go. Mr. McCauley or Mr. Farkas or Ms. Brown, you want to speak to this particular issue about what steps we're going to take related to the contact tracing?
Thank you. What you'll notice is that on the former flow chart, and Mr. McCauley referred to our COVID captain, we are using that person to really help drive identification of those folks that may have been exposed. And we were going to start that process by sending that information to the COVID captain, who will then look at every possible place a student or a staff member could have been. We will look at their schedule. We will look at whether or not they have dual enrollment. We will look at any extracurricular activities, what transportation they've been on, when their lunch period was, any contact that they may have had with a sibling, and we will also contact trace the sibling. We want to make sure that anyone that could have possibly been exposed, that we are aware of those people. And what we will do once we identify who may have been exposed directly, and we followed the protocol that the Department of Health has recommended, which is whether or not there was a face covering, how long they've been exposed to the person, and whether or not social distancing occurred, we will make a recommendation as to, in collaboration with the Department of Health, regarding isolation. But what I think we have to remember is that the students that are directly exposed, or staff members that are directly exposed, we want to communicate that. We believe in full transparency, right? So we are going to notify those parents of students who have been directly exposed. There will be a communication directly with them. But we won't stop there. We will also notify the entire student body, the population at that school, to let them know that there has been an exposure. What we want to make sure we do is make sure everyone is aware that an exposure has occurred, but clarifying that we have already notified those folks who were directly exposed to someone that has tested positive.
Thank you, Ms. Brown. This is very important to make certain that we follow and we transition every step that employee or that learner has taken. We want to make certain that we connect and we educate everyone that could potentially be impacted. And we're just going to be transparent, as Ms. Brown said. We're going to see. So parents, you may have parent links coming at different times of the day, but we just want you to know immediately about the information that we received, so that you can make an informed decision. And immediately our safety and security team will start taking action at the school, and we are currently working with the Department of Health to determine what the requirements will be. Do our learners will they be able to come back after we are going to do a deep clean within our schools, or will they have to quarantine? So we'll have that information in the coming days. Hopefully, we are working with them and having more information about recommendations. And once we have that, we'll be able to articulate that to the board and to this entire community. But whatever their recommendation will be, we'll be ready, whether it's going to be e-learning or whether we're going to be able to return back and have someone ready to go to create that and continue that work. A lot of questions have come up related to the substitutes. What are we going to do with Kelly subs? Are they prepared? Dr. Whalen has had a number of conversations and staff with Kelly. They are prepared. They have a plan in place to continue to recruit individuals just in case. Their current staff may not a portion of their current staff may not be willing to come back due to the current state of where we are related to COVID. So they're going to continue to grow a longer, stronger bench for that, and they're going to have active training along with within their organization to talk about hygiene, cleanliness, and symptoms and those types of things related to where we are. Also, deep cleaning. Not only are we going to identify what has happened within our schools and start that tracking process, but we're going to make certain that we're taking proactive steps to create a clean environment and a protective environment along the way. Mr. Farkas, you want to speak to this particular slide?
Certainly do. We've got a couple things that we've already put in place. The reality is that we need new training. It's a new world for our custodians. We have a training in both English and Spanish that will go out to all our custodians. It also means there's going to be a little bit of a shift. We have some of our night custodians, probably about one per school depending on the size of the school, that will need to be shifted to the day, because throughout the day, on a regular basis, we'll do high touch point cleaning. Signs, things that you'd normally do, hand sanitizers, things that we're going to want to touch, high touch points, we're going to make sure those get the cleaning throughout the day. In addition to every single night making sure that everything is clean within the school. Superintendent Davis had an opportunity to show you what this cleaning station looks like in every school. Learners are going to be a part of that. Teachers will be a part of that on a volunteer basis. But the reality is custodians need to do a deep clean every night. The other part of deep clean is what happens if it says potential closures on here. What happens if there's a COVID case? Mr. Culpepper is, over the last couple months, has gotten a PhD in learning how to do that. He has spent a lot of time making sure that we do that in a proper way in conjunction with CDC guidelines and the Department of Health. I know we keep saying that, but I think it's an important partnership. Mr. Culpepper and his team work countless hours in making sure that it happens. A lot of times we don't plan when those calls come. They come at 3 or 4 in the afternoon. That is when Mr. Culpepper leaves wherever he is, gets on his outfit, and makes sure he goes and cleans the schools. His team has done that. Mr. Davis and I have gotten texts at 1 o'clock in the morning when they finish those saying, hey, this has been done. In front of you, board members, you have the MSD sheet for vital oxide. Vital oxide is the CDC approved cleaner that we use, non-toxic. So you'll have an opportunity, and we'll make sure we make that available to press and to staff to make sure they know what we're actually using. There's an MSD sheet that goes along with that so people feel comfortable about what that is, that non-toxic cleaning and approved agent, so that parents know that this is what's going to happen. The custodial staff rotation is important to understand. There's a little bit of a difference. As we've already talked about, there's a centralization of custodians. Custodians used to report to a principal. Now they're reporting to a centralized custodian whose focus is cleanliness. cleanliness and inspection. So we have supervisors for custodians now we did not have before. Those are actually, their job is to go, we have technology that helps us, a program, they're going to go inspect each one of those classrooms on a random basis. Quality assurance is going to be a key to this. We want to make sure that the public, this board, the superintendent feel comfortable that we're doing what we're supposed to do and making sure that we check up on custodians and that we make sure that they're doing what they're supposed to be doing as well. So you're going to see a different protocol for what happens in the day. You're going to see a different reaction from our supervisory staff and ensuring that that's done throughout the day, and accountability for each one of those custodians, making sure that that's done.
Thank you, Mr. Farkas. And to that point, this rapid response team will be ready to go. So, and as we identify particular issues or validate positive cases, parents, if you're watching, and teachers, you may get the information, 2 hours before the school starts to let you know that we may have to openly make or move toward a potential closure. And so just please understand that we're, if we do that, we're not trying to disrupt you in any way. We're just trying to protect your child, before they come to school. So, but we will do as best as we can to be able to communicate. We're going to over communicate in this particular case so that we can continue to protect every one of our learners and our adults along the way. So, as we transition to identifying whether or not we have a positive case from a learner or a student or a learner or an employee, transition to what we're going to do to track, and now we transition to, what steps we're going to take to clean. Overall, we've got to make certain that every one of our caregivers, our parents, and our guardians, they understand and reiterate the learning delivery options that we have as an organization. And as you know, the option A that we had 3 options. That option was for brick and mortar, and this is very aligned with the emergency order, which makes certain that we offer and open 5 days a week. This is going to make certain that we have new health safety protocols embedded that Mr. Farkas just spoke to, and it's going to be live face-to-face instruction. This is going to be actively involved with elementary children. The students are going to have instructional blocks throughout the day for every core content and reading strategies along with specials. And then in secondary, they're going to have a 7-period day, or some of our schools have an 8-period day to be able to better serve our children due to specialized programs. And then we're going to have care plans that are developed with, consultation with families and doctors for medical vulnerable students. How are we going to help them? How are we going to service our learners to be able to be successful? And I'm going to transition to Mr. Connor for this slide and the next couple slides to be able to talk about what offerings we will have.
All right, thank you. I want to just reiterate too that our students have been out for 5 months without face-to-face instruction, and so there is obviously learning loss that has taken place. And so we've been proactive in academic services to really talk about how are we going to use our diagnostic assessments to diagnose where our students are when they return to us, whether it be face-to-face or e-learning virtual. So we're discussing how are we going to take that information and then work with our teachers to create a very differentiated approach for our students. The challenge of the health and safety protocols that are in place, we'll have to be very creative in how we meet the individual needs of our students through small group frameworks. And so we've talked about how to creatively rotate teachers around to students so that we can begin to have those specialized instructions for students in that small group rotation while being safe and healthy with all the protocols in place. And so our face-to-face instruction really looks very similar to what it did as far as it did previously as far as academics are concerned, barring the fact that we will have a lot of health and safety protocols in place, and it'll look structurally different, but the academics will be very similar. We have provided over 700 professional development opportunities virtually for our teachers just in the month of July. Centered around Canvas, which is our new learning management system, as well as Achieve 3000, as well as iReady, SIPS, which is our new phonics program that was recently adopted. So we're trying to really make sure that our teachers feel comfortable with the resources that are coming on board as we approach the start of the school year. And so as it relates to traditional learning, we are prepared to provide that excellent high-quality instruction based on our new resources, our revised curriculum that our content supervisors are feverishly working on to make sure are strong for our teachers to have the right resources. As it relates to e-learning, what will look different in e-learning moving into the school year than it did in the spring? In the spring, our teachers did a great job in turning on a dime where they have gone from a face-to-face classroom into an e-learning environment. And our curriculum team at the district level did a wonderful job in creating the material so that we can make that transition as seamless as possible. But what we want to do moving forward is we want to really mirror what that experience is like in a traditional classroom. And so you will see in the plan there are a couple of schedules, sample schedules, that we will use to follow in order to first be in compliance with the executive order, but to make sure that we have the structures in place that students are engaging live with their teachers throughout the day and that they're collaborating with students throughout the day. So there's opportunities for that. So if I can just call your attention to page 45, you'll see a middle school sample schedule. And at the top of that, you would see an e-learning bell schedule. And at the bottom, you would see a traditional bell schedule.
Yep.
And if you notice very quickly, you will see that every period is aligned in both models to each other. So first period would begin at the same time, whether that is a traditional model or an e-learning model. And that is to ensure that students have that structure throughout today, but also in the event, because really what's going to drive our e-learning course offerings, and I know there's a lot of questions around what are we going to offer in e-learning? And I would tell you we're going to offer as much as possible based on what our students are requesting within the master schedule. It will be very dependent on, first off, what students are requesting to go to e-learning, and then what staffing allocations are available based on certifications would we be able to offer as far as certain electives. So, unfortunately, we will not be able to offer every single elective that we offer in a traditional setting. We're going to do our best to match the needs of our students based on if they're electing for e-learning, to do that. And we're also going to provide opportunities through our HVS if there are courses that we may not be able to offer in an e-learning setting, where they could potentially enroll for a period or 2 periods for an elective course, or a course that we do not offer through the e-learning process due to the fact that we may not have a teacher credentialed to do that in an e-learning setting. And so we're looking at creative ways, but as you can see in the schedule, this provides opportunities for teachers to engage with their students. And in the event that we may have teachers who have to do a couple of sections e-learning, then maybe they're a brick and mortar teacher, they've elected to come back, but we have requests at a particular school for e-learning sections, and we have the availability to allow a teacher to teach 2 sections of e-learning. This schedule will work very easily for that purpose. So a teacher first period, they may have an e-learning section where they would log on in their classroom and they would conduct their e-learning class. And then for the rest of the remainder of the day, they would have a traditional face-to-face setting. So while we know we have teachers that will be full-time e-learning and they will be at home remote doing e-learning sections, we also know that we may have cases where teachers could do both. So these schedules allow for that. And it also keeps the student engaged in live instruction if they are full-time in an e-learning setting. So I just wanted to point that out to you. As far as our Hillsborough K Virtual, this is our full-time virtual program. We have done a lot of work. We have, under the direction of our new principal, Matt Hoff, who is working diligently to provide a robust experience for students and to ensure that we have enough faculty and staff to accommodate the needs based on the survey, to ensure that students have a full-time virtual option where all of the courses are front-loaded. They're semester long, and students will be able to work on this at their own pace. They will be able to work around the clock. So they don't necessarily engage in instruction at a particular time. They have the flexibility in K-12, in Hillsborough K-12, to engage in that instruction throughout the day whenever it works for them. Go on.
All right.
And then we're going to talk about specialized instruction as well. We have, just so you know, that we will offer a full array of services for all of our English language learners. We will still adhere to our ELL committees and making sure that as needs arise and ELL plans are being devised and updated, that we will be able to do that regardless of what delivery model the student is in. So whether that be face-to-face, e-learning, we are going to continue to make sure that all of our ELL strategies and supports are intact for our students. regardless of the framework in which they get instruction.
All right, so in the next, thank you, Mr. Connor, and also ESE support services, we're going to make certain that every one of our children are committed to free and appropriate educational opportunities. We will follow IEP plans, continue to make sure we integrate, and collaborate with families about what may be best for their learners. We're going to, have every opportunity to, with families to select the best placement for their child, and then we'll continue to make certain that we have telehealth available for every one of our learners along the way that's outlined by their IEPs. We'll make, if their IEP meetings are scheduled and are needed to take place, we'll do that from a virtual perspective if the parent and the team feels that's the best area and best location or best method that they want to interact with. We'll do both, whether it's face-to-face and we'll create social distance, but we'll continue to work with every one of our family members to help them continue to serve our children along the way. And then the other thing is that we have, mental health has been major during this time, and whether it's we've seen some of our families that may have been furloughed. We see our families that have been stuck in the home, and it just ignites some of the some undesired behaviors that may potentially be to grow legs. So we want to make sure that we're there to help our children, we're there to help our employees, we're there to help our families, and move from not only developing the whole child but developing the whole family, and continue to have our hotline available for every one of our employees. And this would be able to look at and support the families and educators, modify schedules where needed to support students, have our crisis intervention team on standby, ready to go to respond when there's a need, and to be able to look and coordinate networks of mental health professionals to determine overall what providers and what services may be needed, and then make certain that we have a blended model of support from inclusive in-person services to also virtual deployment of mental health services along the way. And then we will also make certain that we have the safety and support protocols by offering the EAP to every one of our employees, which is available for 24/7 along the way. And you see the contact numbers, no cost to any of our employees. If they need any type of assistance, we're here for you. Just reach out to us and we'll be able to coordinate that through Miss Brown. She's done a wonderful job with this and her team, because it's all about the well-being of every one of our employees, which turnkeys and positively impacts our children every day. Miss Brown, anything that you want to add here?
Thank you so much. The only thing that I would add is that we continue to partner with our agencies in our community that have been working through Central Florida Behavioral Health Network, and that includes supports around abuse, drug abuse, domestic abuse, any type of mental wellness issues that our students and their families might have. We continue to partner, and we do that both face-to-face, but more now through telehealth. Thank you.
And thank you. We're going to try to offer that as much and often as we can throughout the school year, and if we get a chance to expand it, we definitely will. And thank you, Ms. Brown, you and your team, that all summer y'all been available in the 4 9 weeks, and we're grateful for it and look forward to another launch of it. So the recommendation yesterday, I made a recommendation that I will make formally today to the board, is to move back our opening and from the start of August 10th through August 24th. That is a 2-week window. This date will I understand as superintendent, this has to be approved by the board. In addition to this, it has to be bargained with and reviewed by the calendar committee. Really thankful for Mr. Crete and also Ms. Baxter Jenkins for being actively in this process, to be a problem solver and a thinker for us to move. They've been really good in this process to make certain that they help us protect the working conditions of employees, and we look forward to that continued relationship. But overall, the benefits is about preparation. What are we doing to prepare our schools? What are we doing to prepare our educators to use this as an opportunity to provide professional development and how to really interact with new protocols related to COVID? We could easily open the doors on August 10th. But if we wait 2 weeks, then we can provide ongoing professional development to our teachers in order for them to gain access to rich material and for them to really feel comfortable about how they will extend e-learning, how they'll be able to interact with Hillsborough Virtual, and how they will interact with children as they intake them back to brick and mortar classrooms. So I put a proposed schedule, that we have right now, and we hope to meet with the calendar committee and develop that proposal by Monday. have a final product that we can push to the board by Tuesday, and then potentially, if we need a special meeting, this will be up to the chair and the board, determine if that can to have for approval, so that we can move forward with ongoing conversations about how professional development looks, because teachers, we know they get 6 days of pre-planning, and we want to make certain that if they have those 6 days, then if we push it back those 2 weeks, they're continuing to be paid, because we could leverage the time that we need to get in front of them for professional learning. But however, in this process, it's just not going to be easy as backing it up. We're going to have to look at days that are non-student days in our particular calendar. I know that we have a handful of days that we have that are non-student days, but we also have PLC days, but we don't want to take all of those because we understand the power in that process. So we'll be working through Mr. Crete and Miss Baxter Jenkins to be able to identify in the calendar committee what will be best in order to have the greatest impact moving forward for the 2021 school year. And then the biggest thing, and let me say this, I know that we originally, about a week and a half ago, that we were going to go live with virtual town halls, and for all those who are anxiously waiting to do that, I want to tell you right now, we paused, and I paused that as superintendent, and no one on this board, and I paused that because we just wanted to get it right. We know that there were so many questions out there that we were intaking emails. We wanted to make sure that we had the time to review all the feedback and input that was being pushed to the board and to me and my team, that we wanted to absorb that and be ready to articulate and address every thought, every recommendation, every concern, and build that within this plan. And you will see the majority of the elements that were exposed and sent to us is and thank you for sending your information, board members, to me, the questions that you received. We have taken that. We've allowed that to be some of the foundational efforts within our plan. But this puts me to being able now to go communicate openly, to have we'll have an in-depth with Davis next week with some of the same team members, just talking about and reiterating some of the major big ideas, and we will use the feedback that I received from the board today to integrate that. We will also update the FAQs to the number of questions that have been presented, so that we can alleviate any questions or angst that may be extended from our caregivers or our employees as well. And then I will host virtual dialogues with Davis on these 2 dates, and Monday from 5:30 to 6:30 will be 1 hour that me and my team will be ready, available to answer any questions. And then Tuesday, July the 21st, from 10 a.m. to 1 a.m. From 10 a.m. to 11 a.m. we will record these and we will capture them, and then we will upload those along with our FAQs in this plan, so the community can have ongoing interaction along the way. So, we in this past Sunday's Hillsborough Responds, we asked our constituents to send any questions they may have, to send questions, to send any suggestions, any feedback. We want to thank all of our constituents for taking advantage of that and doing so. These are some of the major questions that we've embedded into our plan that will be embedded in the FAQs, along with how do we respond to COVID. If we select a pathway for e-learning, can we change our minds? And will there be exemptions? How will playgrounds be sanitized? All those will be embedded into the FAQs. And along with human resources, if a teacher tests positive, will leave be covered? And as of right now, leave will be covered if they qualify for the I think it's the CRA Act that has been extended through December 2020. That will pay, and you'll have to apply and pay a proration of that employee's salary. And then another question: if an employee has to quarantine due to a positive case within their home, will that employee be paid or have to take time off? Openly, if there's an exposure, that employee that's outside within the home with a family, that employee will have to use their leave. And but the board, we're going to have a conversation about what happens to an employee if a learner the learner tests positive, which is documented and verified, and then now the teacher's exposed, the teachers now test positive and they have symptoms, and that's verified along the way, and then that individual has to quarantine. So that's a question we're going to have a conversation about. I do believe in that particular area, we probably should take care of our employees. However, if they are if it's verified through a student, verified that the employee was exposed, then I say that we probably should. Anything outside of that, the employee will have to use their leave and follow that act in order to qualify for it. And then also teaching and learning. Some of the questions we got, what is the, day of e-learning? Mr. Connor spoke a little about that, and it's embedded into our plan. Will there be flexibility for parents with the e-learning related to, do they have to be in front of a computer all the day? The answer to that is no. We've embedded a sample model that students will be able to follow within our plan. And then how will electives be offered along with the e-learning? We know that we not be able to offer every one of our classes in e-learning, especially electives, where we're working collectively with HCTA to see if we can look at a virtual live stream. But that's all going to have to be bargained. It's nothing that we can set in stone. And if we are able to do that, it'll be on voluntary basis of our employee. And we want to be able to protect our employee along the way, and we'll give them comfort if we're able to reach an agreement alongside of that. And then exceptional students, making certain that we follow IEPs. Are there going to be exemptions related to mask? And what are we going to do, for child e-learning? Will the services continued? We've answered that along the way, and that has been embedded in the plan. So these are some of the big questions that have been asked that we've put in the plan, and staff will be able to answer today if needed. So one of the questions is, what is the projected cost of COVID? What it was projected cost, what is that going to look like as we have to launch? And these are very, very rough numbers. And these are numbers that I've worked with staff to capture and calculate. We see that we're going to have Zoom license to be able to have an interactive pathway through e-learning. We're going to have courseware to make certain that we have course offerings and that we like Edgenuity to be able to extend to our students, and we could use that we'll use in concert with Canvas. And we're going to have a lot of people on the side with district staff, school-based staff that we hope and will pay to write curriculum to upload all of the e-learning lessons, especially in elementary, to be able to have that accessibility for teachers and for parents along the way, which is a substantial amount of work that was going to have a real cost, which is around $3 million. And then PPE materials, our masks relatively are around $1.8 million that we are spending related to PPE equipment, and that is going to once again 3 reusable masks to our employees, 3 reusable masks to our students, and then and that's alongside having to disposables that we give for students and learners that forget them, and then having disposables for every one of our learners that get on the bus every single day. And then signage, custodial supplies, and then we're going to have glass shields where appropriate. And then we're, in this side, we're not going to be able to use water fountains at the launch of the school year. So we're going to have to invest in water bottles to be able, and that's going to be a significant cost. Mr. Farkas right now is working through a number of partnerships to see if we can get, to get a discounted cost, to see if we can get this donated. So that information will be to be determined. And once we get that hard number, we'll let you know. And then finally, student devices. And you can see the funding sources that we've identified this. Openly, we may have to use SAI to get some of this off the ground, but it has been put in the ESSER grant for reimbursement. But we just want to be transparent about what funds we're using and what funds we'll be able to accrue back based on the grants that are available within our organization. Mr. Farkas, anything that our team members, just for anybody, anything that you want to add here related to expected costs, potential costs that we may want to look at? We're good. And you'll see today, for our community and board today, for me, it's easy for me to sit up here and speak to all of this. And why I've been actively engaged in this work, these individuals have worked tremendously hard. And today I wanted to showcase their knowledge, showcase their focus and their intensity, because they're working every single day along to make this a special experience for children. I thank you for your hard work. This team has worked overtime. I know that I know our work's not over, but thank you for being champions for kids every single day and being a part of this. Thank you. That's it.
Thank you, Mr. Davis, and thank you to all of your team members who helped put this together. Quick apology for my delay in being here this morning. I left a graduation drive-through to get here and was delayed a little bit, but they're going extremely well.
Thank you. Good news.
Really, really well. Very organized, and the parents and students are very appreciative.
Good.
of the effort. So thank you also, Ms. Schamberger, for helping out until I could get here. And so at this time, I'd like to go ahead and allow some board member comment. We do have some time constraints. So also, Pablo, if you could please add Dr. Hahn and Mr. Kona to the list. I want to put them in the queue. And what we'll do then, if you haven't already discussed it, is give every board member about 2 minutes, and we'll start there, and we'll just continue to rotate. But want to make sure that we give a couple minutes for every board member to ask any additional questions that they might have, make any comments, recommendations, and so forth. And then we'll continue just to put yourself back in the queue if you have additional questions after your time limit has passed. Okay, so we'll go ahead and start with Member Gray. And Pablo's going to keep time for us.
2 minutes. Oh boy. Okay, here we go. Here we go. Well, I want to thank Superintendent Davis and your staff. I know they've been working 24/7, and I appreciate it. And I'm also very relieved that that you are working closely with our community partners, our religious organizations, our union, especially our teachers, of course, and our staff that are also added above and beyond you all. So. And it seems to me that you're seeing this through the eyes of public safety. It is a public health issue. It did get politicized, and we all can apologize, but that's the reality. But I'm not a political person, so I'm going to go ahead and just talk to you as I feel as a grandparent, as a former teacher, and as a board member. I see this as a epidemic that is right now probably out of control, as we're reminded of, I think it's 54 hospitals now in the state of Florida that are at full capacity of the ICU, and 40 of them have 10% left of capacity, and actually Tampa General today is now not taking any more elective surgeries. So I see this as a rising emergency, and it's really starting to eliminate the options. And you've done an excellent job with the options that you are sharing, especially as it relates to the innovative e-learning. And I just want to know, or to at a time that's appropriate, that we are reminded that we may have to pivot again, because Superintendent Davis, you have children, I have grandkids, Ms. Snively has children that are up in age, but still, I'm trying to get a smile at her. And one of the things we're facing is, if our children get sick, that's one thing. I'm looking at filled hospital beds. I'm almost done. And but what if one of our teachers gets sick, and one of our children, and there's no more hospital space? So that's what I worry in 3 weeks. That's what I'm worried about more than anything in the and I'm going to have to be quiet. So I hope that we are flexible and fluid, and that we are able to pivot. And I'm not sure what the appetite of the board is. We'll find out. But I have other questions, and I just want to end with this this message that you have listened. You see what's out there, and you know we are probably in for more reality than we would want to readily admit. But I also see that you are ready to also face that as well. Thank you. Thank you, Madam Chair. Sorry.
Thank you, Member Gray. And I know that the time it will be short. Everyone should be able to get at least 1 or 2 questions in before we continue to go on from board member to board member, but we'll continue to rotate. So did you catch that question?
Yes, ma'am.
From Ms. Gray?
Yes,
in there?
Yes, ma'am.
It was in there.
Yes, ma'am.
Thanks. Okay.
Yeah. So through the chair, we are ready to pivot. We understand. I mean, we see the, I had a conversation with the Department of Health today, and I'm trying to figure out openly why Hillsborough County is in phase 2. When you look at the comparison to Palm Beach, when you look at the comparison to to Broward and you look at the comparison to Miami-Dade, we're right there with Palm Beach. I mean, they have 22,000 cases. We have 21,000 cases. Through the conversation with the Department of Health today, we are seeing 700 new cases a day. And, so we have got to pay attention, for me, you see, and the question becomes, Mr. Davis, why can't we automatically right now go to e-learning? Well, openly, if it's, you see that you have 3 other counties that have done it in the South. And, Miami-Dade has 50,000 plus cases, maybe close to 60,000 cases. You have Broward that has 34,000 cases. Palm Beach at 22,000. I think we're around 22,000 as well. But because they're in phase 1, they're still the stay-in-home order, and we're not. So, with 700 positive cases a day, I'm openly concerned as an educational leader for our children and for our employees. The issue is that you have a match with the executive order which says you will open up for 5 days a week to our learners. Now, I openly say this. I said it yesterday, and I believe it every single day. Is that my timer? I get 2 minutes? Sorry. Every single day is that the best way to educate children is face-to-face. But we're ready to pivot. If we have to pivot, we will. We want to try to get back to face-to-face when we can, soon as we can. The issue is that if we continue to see a upward trajectory, we just may not be able to do it. But we're realist about it. But we also have to be prepared for and implement best practices for our children. So every one of these options we're ready to extend, we're ready to do, but we'll continue to monitor every single day to make an informed decision. So thank you for your comments. It's difficult. This is a difficult time with difficult decisions, and we're going to continue to monitor it to make the best decision that we can and that we know of through the lens and the assistance through health practitioners. Thank you.
Thank you so much, Member Gray, Superintendent Davis. And so I'm next in the queue, so I'm going to just take that opportunity. It's certainly an honor and a privilege to be back at the dais. As you guys know, I was recovering myself from COVID. And, when I reflect on that, I'll just be very honest. I was very blessed and quite transparently very privileged to be able to make a decision to stay at home, to work from home, to make a decision that was best for me and my family. But when I think about so many families, Hillsborough County School District families, Hillsborough families, especially those most vulnerable families in District 5, they don't have those same options. They don't have those choices. They depend on us to be able to continue their livelihood. They're depending on you, Superintendent Davis, to make the best decision for them. They're depending on me as their elected leader and my colleagues as their elected leaders to make the very best decisions for them. And those are the folks that I'm most concerned about. Thank you for the update. I think you and your team have done a magnificent job at coming up with a reopening plan for 2021. And I want to just clarify what I say that. I am so concerned about the rise of COVID cases here in Hillsborough. Just 14,000 cases, new cases reported today, with Hillsborough continuing to climb. Now, I am pleased to hear that we have this COVID captain and children with symptoms will be isolated. That's fantastic. But as the only person that's had COVID on this dais, let me tell you something. By the time someone shows up with symptoms, it's likely too late. You would have exposed everybody you've come in contact with it. It's something that I still agonize today, that how many people? I was with Member Stewart and other board members before I was even diagnosed. And I tell you, it wasn't until I was diagnosed that the symptoms really became bad. And so I'm concerned about that. So while this is a magnificent, comprehensive plan, I am concerned that it is a little light on addressing the real risk. And let me just close with this, because this just comes to mind. I think about our soldiers on the battlefield who, when they're under fire, they take cover until it's safe. They don't count bullets and decide when to come out when a certain amount of bullets have passed. They come out when the coast is clear and they're positive that the threat has passed. Our students and our teachers should never have to dodge a bullet under any circumstance. And to target a date on a calendar kind of concerns me. So I'm going to jump back in the queue and I'll finish my thoughts, but I'd like to know how you came up with the 24th and what flexibility we have in moving past the 24th. I know there's an executive order. I'm willing to look at any consequence that may come along with violating that executive order, because I tell you, the life of a student and a teacher is far more greater than any consequence this district will ever suffer. But I'll get back in the queue. Member Stewart, you're recognized.
Thank you, Ms. Schimberger. And I'm not going to reiterate what Ms. Schimberger has already said, because I feel exactly the same way. Unfortunately, learning loss can be corrected, but life loss can't. And we're talking about people's lives here. I had a conversation on my way to this office today with several people that, while they support that we want to open, they just don't see how it is functionally possible for us to. We can't suppress this virus in our own community. How in the world do we think we're going to suppress it in our schools? There is just no way. And when the CDC puts out guidelines, those are supposed to be the minimal that you do before you are now negligent. And I don't think we can even meet the minimum standards of the CDC guidelines. We can't do social distancing right now. And I know that Mr. Holt from the DOH is probably not going to come here and stand here and tell us what to do. We are too large of an organization and we're governed by a board. But I probably would feel very comfortable that he is going to tell us that until we get cases in this community to 10 per 100,000 instead of 50 per 100,000, which is where we are today, we should not even be talking about this. 30 minutes before this meeting started, Superintendent, I sent you an email. And I asked you to please not just push back the start date. I'm asking you now to consider, at the next meeting that we have next week, to consider e-learning for at least the first 9 weeks. I think it is unconscionable for us to, one, have to make this decision for our families. I am having a question and answer. All it is a question and answer tonight on a Facebook Live as a school board member. I have over 1,100 people who have signed up just to speak, and I'm trying to vet questions so that I don't have to repeat questions. And I think that's way too many unanswered questions about how you're going to keep not only me, but my child and my entire family. I sent Mr. McCauley just before we started just a contact trace piece about how we're going to try and keep track of people. And I'll get back in the queue, but I think that the funding for what we're talking about, the cost of this is grossly understated. Even we just talk about custodial and the supplies, the labor costs aren't included in this, the extra time that's going to be needed for cleaning. I can't imagine what our sick pay, our extended leave pay is going to be. Those are not things that we're counting on. Those are long-term effects if someone has to take off additional time from work. We're not prepared to start paying out sick pay and vacation time and leave time to people to take off long periods of time. And then what do you do with the students in a classroom? We're going to rotate subs in. We might as well have left kids at home doing e-learning. It is just much more responsible for us to take a little more time. 2 weeks is going to get people trained on Canvas and Ingenuity and Achieve 3000 and an appropriate and positive way for them to teach to kids at home. Give us some more time for this community to heal. This is a community issue. This is not just our issue. So I'll get back in the queue. Thank you, Madam Chair.
Acting Chair. Thank you so much, Member Stewart. Member Perez, you're recognized.
Thank you, Member Schamberger. So I am one of those professionals here on the dais that is a healthcare professional. I've been one for 20 years in the hospitals. And we get healthcare training 3 times a week for COVID since March. It's not a one and done. And so on Saturday, I put a post on my Facebook, and I received 900, close to 1,000 responses. And it was reposted close to 400 times. So when there are healthcare professionals who are anxious and very much on edge, dealing with patients and individuals who have been exposed or are positive for COVID, I can't imagine the angst of our teachers, our parents, our staff, and our students, what they are feeling. So how are you going to be providing ongoing training for our staff and teachers, and more importantly, our students, in the direction of safety, self-care, and physical wellness? That's one question. Second question is, how often will you be replenishing the sanitation stations, and the calculated cost for this replenishing? Is it every 3 months, every month? You gave us a figure here, but you didn't say on those figures, is it a monthly cost to us? How did you calculate these figures? It just says a cost to us on a monthly basis. How did you derive at these costs?
Yes, ma'am, to the chair. We're going to provide ongoing professional development. It has to related to safety and wellness. As we continue to work through Climate and Cultures Division and the executive team and leaders with the health department, and as we find new trends with, how to combat COVID, we'll have to have constant conversation. That's going to be a part of everyone's pre-planning, return planning, and at the same time, continued professional development throughout the year for our teachers and our administrators, just to keep this in the forefront. And wellness has to be an active part of that. And so we're going to leverage the knowledge of our psychologists, our social workers, in order to provide connections and to be able to help our learners along the way, along with school counselors. Mr. Farkas, can you speak to overall some of the costs related? The sanitation stations are going to be refreshed immediately upon depletion. So can you provide that information related to financial cost?
Certainly. Thank you, Superintendent Davis. The reality is I've heard a few hundred times from my boss that we need to make sure we don't run out of supplies for this when we return to school.
Say that again.
So that is one of the things that we've focused on. We have what we are calling a reserve of supplies that are not going to go out in case there's an emergency. We'll send those out. But the reality is it's got to be a replenishment. We've talked to 4 and 5 vendors for each one, whether it's wipes, masks, gloves, things like that, that they have assured us they'll be able to do that. So we have backup plan 2, 3, and 4. The cost that you saw from us were our initial purchase. So, for instance, our wipes, that's 300,000 wipes. That is 50,000 of the masks for the disposable masks. It's about 600,000. We didn't purchase those for the reusable masks. So those costs are not a constant. They're a fluid as well. As we replenish, we will do that. We will have a reserve so we don't go down to zero. But the reality is that cost will go. How quickly we go through those will dictate what that cost is. We didn't want to present a false narrative up here. We wanted to make sure we give you the real cost of what we bought up to date. As those, we can update that as we purchase every single board meeting.
Thank you, sir.
Thank you, Member Perez. Next, Dr. Hahn.
Thank you. Can you hear me?
We can barely hear you.
Uh-oh. You can barely hear me. Hold on.
No, she's testing it out. Let's see.
Is that better?
That's better.
Okay.
Yes, much better. Thank you.
Okay. Well, first I want to thank I'm getting a lot of echo. Sorry about that. Well, first I'd like to thank the superintendent and his staff. I know they worked long hours to prepare for today. And I'd also like to thank them for reaching out to the community and business leaders, as well as the collaboration with TGH and USF Health. I also want to thank my constituents for reaching out, like my other colleagues, hundreds and hundreds of emails, phone calls, and that is incredibly valuable input that is, informing myself. I know I've shared some of this with the superintendent and staff, so I know it's informed his work, and I greatly appreciate that. We've seen the steps the superintendent has made over the last few weeks around the mask mandate, as well as moving the date and moving the date for the parent intent forms. I appreciate you taking everything into consideration that the constituents are sharing as you're making those decisions, Superintendent Davis. Obviously, safety is what needs to drive this work. And I appreciate the choices around the learning choices that we're providing our families. That's important, but our teachers don't have those choices because for many of them, they have to go to work every day. They can't afford to take a leave of absence. They need a paycheck. And as you stated, there's not going to be enough e-learning and virtual learning positions for the teachers who really need to protect themselves or family members for various reasons. My colleagues have made some excellent statements and asked very good questions, some that I was planning on asking. But so I'll move on to questions that haven't been asked. One is regarding protocol and process that are going to happen at schools. Are there going to be staff members identified or maybe new folks brought on where their focus is on implementation of process at schools? An example might be around masks. How are we tracking the distribution of masks so that we can properly budget? Because like others said, I am concerned that, we're budgeting certain dollars, but, that we may quickly find out that those dollars were not, going to cover the costs. And then also for teachers, can you and I get a lot of questions from teachers around how moving from teaching face-to-face to perhaps into the Hillsborough virtual, will there be any penalty on their retirement, sick days that have been banked, any type of benefits that they received face-to-face, any of that in jeopardy if they move to a virtual type of situation, whether it's e-learning or Hillsborough virtual? And then real quickly, for students who are e-learning or Hillsborough virtual, will they be able to participate in extracurricular activities on campus if parents feel comfortable with that piece of it? I don't know really how much more time I have to ask questions, but I've probably...
Let's start with that. Those are good questions. So we'll put you back in the queue, Dr. Hahn. Thank you so much.
Thank you, ma'am.
Okay, go ahead, Mr. Davis.
Yes, ma'am. Through the chair. Thank you, Dr. Hahn. I appreciate it. Yes, we are going to have at the district level. We're going to have to hire someone to help us coordinate these efforts. And we put the individual as a COVID commander. We'll figure out a better title down the road. But that individual is going to help us be able to track what's being extended to schools. We're going to ask schools to identify a COVID point person as well, to be able to track PPE equipment, to track information in order to make certain that we are budgeting properly. I'll let Mr. Farkas speak to that before I answer the other two questions.
Thank you, Superintendent Davis. We have someone in our staff that is going to be designated a new hire that's already going through the hoops right now, that their entire job will be to ensure there are supplies at every single school, that reorder that you talked about and how we're going to do that sole individual for that job temporarily is going to be just making sure that every school has supplies, keeping track of those costs and where they're allocated.
Thank you, sir. And through the chair, we'll have to track the first month and see what our actual expenditures are, and then try to forecast that and duplicate that, every single month in order to remain and stay in budget. We know that that's going to be fluid, but along the way, I promise to keep the board apprised where we are financially, and in order to create a safe environment. As relates for virtual, and I appreciate the board members' requests and asks. For weeks, we've been looking and prepared to transition to e-learning if we have to. This is the reason why we've brought on Edgenuity and other platforms, that we are ready to go if we have to pivot, and we know that could be something possible in the near future. So, we were just waiting for that point where we were transitioned to phase one, or there was a direction from the board. forward. But right now, we are prepared. But as it relates to someone transition to Hillsborough virtual or e-learning, it doesn't impact them in any way, shape, or form related to their profession. They will continue to keep their years of service, and they will continue to be in the same role, just in a different, delivering a different manner, not brick and mortar, but just in a different platform. At this time, there's no incentive for individuals coming back to brick and mortar. That's not, been a discussion openly. So there will not be any individuals being incentivized to return. And then as it relates to activities, we have a number of learners that are going to transition, a big bulk, 40+%, that will be in e-learning or through Hillsborough Virtual. They will be able to participate in extracurricular activities or athletics. They will just have to do it to the e-learning school they're attached to, along with their neighborhood school that they are projected and forecasted to go to be able to participate. So they can't live on one side of the town and then go to play athletics at another school on the other side of the town. It's got to be with their identified neighborhood school to be able to participate. And we encourage students to continue to do that.
Thank you.
Yes, ma'am.
All right. Thank you very much. Mr. Kona?
Yes, I'm here. Can you guys hear me?
Yes, we can hear you. Thank you.
Okay. Mr. Superintendent, thank you and your team for putting together a very thorough plan. Obviously we have been tasked not only by the state, but for us to reopen schools. I understand the settlements of all of our board members, and I agree. This virus will dictate the direction, and I believe that this reopening plan is very thorough. Congratulations to you and your team for putting together such a plan. But we will have the ability to pivot, just like the superintendent said. And if we have to switch to e-learning for whether it's the first 9 weeks or whether it's the first semester, we'll have that ability to do that. But this plan is for how we are going to reopen schools. I think it's thorough. I think there's some obviously there's some tweaks that will have to happen, but this virus will dictate ultimately when we actually go back to schools, brick and mortar. I do think it's the best way for our students to learn. I do think that our investments that we've made in Canvas is going to pay dividends if we have to switch in the middle. My question, and I guess this is for Terry Connor, is are we preparing, whether it's a brick and mortar teacher or an e-learning teacher, to have the same types of lesson planning being done in Canvas? Because if students get sick, obviously, or if a teacher gets sick, having that coursework in Canvas, is that going to be set up so that it's kind of seamless regardless of whether they're brick and mortar or they're e-learning?
Yes, sir. What we're doing now is we're taking all of our curriculum guides and resources that are in various places right now within the district technology systems, and we are migrating them over to Canvas. So all teachers will have at their fingertips within Canvas all of the instructional materials and resources so that they can develop their own unique lesson plans or follow the district created guides as well.
And my last question, are we putting together some sort of educational tutorials for our students to learn how to navigate Canvas as well?
Yes, sir. We're doing that for students as well as parents, and those will be rolling out very soon.
Thank you. That's all the questions I have.
Thank you so much, Member Kona. Member Gray, you're recognized.
Thank you. And I just want to be clear, too, because I think every one of us, and of course, I've been a former teacher for elementary, middle, and high school, and I am a coach, so the importance of teaching is critical. And actually, Superintendent Davis, you've been a teacher as well. We know brick and mortar is the most valued model. We know this, but and I appreciate, again, that you're able to look at the data and change upon the need. My question is this. We know that the funds for innovative e-learning have been decreased in terms of the from the legislative folks, and yet I see such a wonderful atmosphere of talented implementations of best practices educationally in e-learning. And I use the word innovative because you all did, and I think it's a great way to inspire our community partners and our community folks that this may have to be the reality for 9 weeks. So if we are defunded, Superintendent Davis, how will this affect us?
So through the chair, through the executive order, we will be protected financially, and overall through October per that directive, and we're grateful for it. The biggest thing is that anytime that we obtain FTE through students coming and enrolling within whatever platform it may be, that will generate the funding to be able to pay. So that's still intact. While I know that there was some funding that was cut, we're going to be protected in that process, and I don't see or forecast any overall financial impacts in those particular areas related to virtual.
Very good. And one more question
Yes,
real
ma'am.
quick. The idea of the, excuse me, health checks, I am reminded that, for instance, Pinellas County has health assessments. So can you just share what precautionary measures will we be giving our parents and our students to make sure that they are assessed, and not only but on a daily basis?
Yes, ma'am. Through the chair, we'll be sending home some information and uploading some videos to make certain that parents understand how to do the well checks at their house and their dinner table before they come to school. So whether it's taking their temperature, just asking them simple questions, looking for particular signals that may put their learner in a situation where they may not be physically healthy and ready to return. But along the side, we're going to also continue to take proactive steps to coach our teachers. Do a great job. They know and see when the learner Addison Davis isn't feeling good, and they ask a lot of questions, and they leverage the nurse along the way to be able to help that student. So, Ms. Brown, anything that you want to add in relation to what we will be doing to further help our students or our parents?
Yes, sir. We're really excited about the videos that are going to be produced, and we think that will be a tremendous help to our families in understanding exactly what they need to do to pre-screen or to self-screen before students report to school. And that will include a real questionnaire around whether or not they have certain symptoms and whether or not they've vacationed or been visited outside of our community, as well as whether or not they have been exposed to anyone in their household that might be positive. So those are some of the things that we really are going to pay very close attention to make sure that our families know exactly what they need to be asking before they ever report to school. Thank you.
Yeah, and the recommendation that I shared with Superintendent Davis to have, just the analogy would be our Wi-Fi hotspots, is to also perhaps have, and I'm just throwing this out, buses, but to have local community CV tests and contact tracing, if that would ever be, if we could work towards that, because I think the reality is we're going to be here in this virus for a long time, and we've got to help our children and families that cannot have transportation to get all the adequate testing, etc. Thank you, Member Schamberger.
Thank you so much, Member Gray. And we still have about 20 minutes left of this workshop. So, Member Gray, you're welcome to get back on the queue with time permitting if you have additional comments or questions. So I feel like we are still talking about step 2, Superintendent. And I don't really mean to push back hard against you because I'm working with you to make sure that we get this right. But I am a bit one-tracked focused, I guess you can say, today, which is on the rollback of the opening date. And so I just want to, we talk about this executive order. I just want to remind what at least I perceive as the home rule. Mr. Porter, probably has a legal definition. But listen, we are elected leaders here and an appointed superintendent to make the best decisions for our community. And so I'd like to see that we self-identify as level 1, that is supported by the increased number of cases, COVID cases being reported in Hillsborough. Even today, we're still on an uptick. And so with that, we know level 1 e-learning is the most viable option, which would have to include, by the way, Superintendent, parent training, making sure that our parents who may not be computer literate or may not have the abilities can sufficiently support their students. So I just really would like to know, one, what's your thoughts around that? What's stopping you from making that decision, or why have you decided against that decision? Or is this something that you're willing to consider as a recommendation for July 23rd?
Yes, ma'am. Through the chair. Thank you, Ms. Schamberger. It's definitely been on everyone's mind related to our executive team. We are trying to figure out and look at every analytic that we can to make an informed decision. Right now, I haven't made that decision due to the emergency order from the Florida Department of Education. I can and willing to have conversations to see if there's any financial penalties. If there are, I will articulate and share that with the board, and then order to make an informed decision. I've had conversations about the emergency order with many members of the Department of Education, just talking about seat time, hours, the number of days that we have to be implemented. And to your original question, why we came up with the 24th is because the emergency order says that we have to start school before August, and for us to before September, in August. Sorry, everybody's like, okay, you're late already. So before September, so we had to start in August, being August 31st being the last day that we have potentially to do so. So looking at the way our calendar sits right now, where if we started with my recommendation, we're still 8 days out that we have to be able to make up. And so I didn't want to be able to push it back with another 5 days, that we'd had to be 13 days if I did it on August 31st to be able to make up. It's hard enough to be able to find the time. We talked about, we've had a number of conversations of how many PLC days it would take, which we want to try to protect, looking at time that we have, because we have time. Teachers, I'm not saying this is what I would recommend, but you look at time that we have a week for Thanksgiving, you have a week for spring break, and we want our employees to have those times to let their hair down and relax and step away and to rejuvenate, to be able to come back. But those all have to be conversations, unless the board is willing to pick up the financial cost, being able to push it back for the 8 days or the 5 days. The other thing I asked, is there potential for the school district to make an informed decision to just waive the days? And I got pushback from the Department of Education stating that, that would not be favorable. But however, I'm going to have conversations with Mr. Gibson about that to see what he believes to look at with emergency order in order to make an informed decision. But I'm open. I'll have the conversation to see if there's any financial impact. And if there is, I'll make sure I share that with every board member. Yes, ma'am. Okay.
Thank you, Member Schamberger and Mr. Davis. Ms. Stewart?
Thank you, Madam Chair. I didn't get a chance at the first time I spoke to. I do want to thank your staff and you. This is certainly, in less than a week, a much more comprehensive plan than we saw last Tuesday. I think what we saw last Tuesday was a lot of ideas and a PowerPoint presentation, but this, what we're looking at is really a solid plan. And I know it's going to be fluid, but if we can get this up on the website for people to start looking at and critiquing, and it answers a lot of questions that are being asked, I know, of all of the board members. And I started answering emails yesterday, and I couldn't answer them fast enough. People were starting to criticize, you've had my email for 24 hours and you haven't answered me yet. I'm going to reiterate again Ms. Schamberger's stance as well as my own, that I think we need to set the example for this community. And right now, we're not setting the example by opening schools. And for me, technically we are in phase 2, but really the numbers put us in phase 1. And even if you just ask around, I had conversations this morning with the Public Defender's Office. I've had conversations with the Florida Department of Transportation about how closely they are monitoring their employees and the things that they're having to do to say, Mr. Davis, were you exposed? Okay, you've been exposed. The trace contact documentation and following alone, I don't see how anyone who is in, that is more than a one-person job on a school grounds, number one. And it is so complex to try and track. Ms. Schamberger was exposed. When was she exposed? When was she tested? When is her date to come back? How much leave does she have? How do I pay her? That is not a one-person job when you're talking about a high school with more than 150 employees, and that's just the employees. We're not talking about students or family members who may come on, or contact in a household. So it's just overwhelming right now with the numbers that we are at. So I agree with Ms. Schamberger. I would really like to see us talking about being the example in this community whatever it takes for us to push off our opening of brick and mortar for another 9 weeks and give us time for this community, the community, to get this virus under control. I know that the mayor's office is potentially looking at another shutdown from the city of Tampa. If that happens, then what? We're going to have part of the county open for school and part of the city shut down? Or are we just going to ignore that order? So I have real concerns about the fact that we're still talking about all of the things that come with, and there's still a lot of unanswered questions. And I think that is what is giving our administrators angst. It's giving our employees angst. It's giving our families angst about what decision to make. What decision do I make? If you can show me, even through the pre-K program, if you can show me the number of cases that we have presently active in this district, which I don't have, how many employees have come back to work so far, and how many have been infected, and how have we handled that? I have seen none of that from this board or the district. And we did so much to tell everyone how many meals we prepared, how many devices we handed out, how many people called mental health lines, how many people needed device help. But we have said nothing about the number of cases that are active in this district. No one knows. And I think we need to put that information out there, and we need to tell people how we're managing that, and at least give people some level of comfort for how we're managing our own employees that we've asked to come back. But I still think that bringing 212,000 students and all of our teachers back into the mix is way too much for us to grapple with, and I am not sure that it is fair to this community to expose that many people to something that the community does not have control of right now. So thank you.
Thank you, Ms. Stewart. And since I've had to try and manage being present at 2 meetings today at the same time, I've actually figured out now how to be in 2 places at once, thanks to technology. I would like the opportunity just to make a few comments. I appreciate that, if you wouldn't mind, Ms. Press. So being a member of the Emergency Policy Group has given me a unique perspective on information. We are, I would say, in the lightest way, inundated by data twice a week and in between, because it's not just the EPG meetings where we get presentations. We also have multiple conversations and meetings before the meetings and after the meetings and in between the meetings. And so it has been a very enlightening experience. What I wanted to share, some personal and some professional, is that if you look at the county's dashboard, I have it actually pulled up right now on my computer screen. If you look at the Hillsborough County dashboard and you listen to the EPG meeting today, you will hear Dr. Holt say that it is flattening. And if you look at the data, you'll see the chart, cases per day, is actually accurately, he states that it is flattening and it is going down. Now, we don't have a crystal ball, and we don't know what's going to happen in the future. But I did sit in the Department of Education board meeting yesterday and clearly heard the governor and the Commissioner of Education and the majority of the board say, we will offer brick and mortar for parents who want to send their children back to school. And I appreciate the sentiments and concerns that my fellow members have brought forth today. Ms. Stewart, we would not be sending 212 students back to school. We know that 212 students are not going back to school. I'm sorry, 212,000, thank you, students are not going back to school. We know that probably maybe half of our parents want to send their children back to school based on the data that we have collected so far and based on some of the anecdotal information that we've been seeing across news media and social media and just our personal interactions and emails that we've had, conversations we've had with other parents. I have a contingent that I represent who is anxious to send their children back to school. And I would say probably 40 to 50% of the parents in our county are ready to send their children back to school. My students, my 3 that stayed home to do distance learning, did not adjust well to distance learning. They need face-to-face interaction with the teacher. They need structure, and that's how they learn the best. And we know that that's how they learn the best because studies show that that's how they learn the best. But the beauty of it from the board meeting that I sat in yesterday is that people do have options. And let's give those options to people. If you don't want to send your child back to school, that's okay, because you have that choice as a parent. You can keep your child home. But there are some parents who don't have the option of doing that, and they've been out of work, and they've been compromised employment-wise, economically. They could be socioeconomically marginalized because they haven't been able to go back to work, or they're having to consider childcare and all the other things that go along with that. And they're not able to do another 9 weeks of e-learning. And guess what? That's okay too, because we can offer them brick and mortar if that's what they need, so that they can go back to work and so that their children can learn effectively. So in my opinion, I will quote one of the board members yesterday from the Department of Education, and board member Tom Grady, who's a former House member, said he thought that the order from the commissioner was timely and spot on, because he thinks it's important people understand that kids are being harmed by not being in the classroom. So the question is, how do we weigh a clear threat to a young child's education against a murky risk to their health? He said, I think it's essential that people understand that kids are harmed by not being in school, and the support that the order will give the districts in making their own individual determinations is essential. It's about choices, and we need to give our parents and our students choices. We are not forcing anybody to go back into a school if they do not wish to do so, but we are giving them options to do that, or to stay at home and learn, or to enroll in virtual school. So I feel very strongly that we need to continue with giving our parents those options. And if we have to change things, guess what? We can. If we get 3 weeks into school and all of a sudden the cases escalate and it becomes out of control, then we can close down the school and go with distance learning if we have to. And that will, the state will help us make that determination. So that, I just wanted to put my opinion out there for what it's worth. And I appreciate the sentiments of the other board members, but I feel very strongly we need to offer brick and mortar for students, not just because it didn't work for me as well personally. I mean, that does place a part into it. I am a parent. I do have 3 students in school, but I know hundreds, thousands of parents who want that option to be able to send their kids back to school. So thank you for allowing me to make those comments. So we'll go back into the rotation. Member Perez, you are next.
Thank you, Madam Chair. So we were informed today that 1 out of 3 children in Florida tested positive for COVID. So we have about 40 people in this room. So that would make about 13 people in this room positive for COVID. So imagine us in a room full of 13 people that are positive, and we don't know who it is. That would be what our teachers are exposed to. 1 out of 3 of their students. So, Mr. Davis, are you preparing like the deaf students to have interpreters? What is your, do you have the slots to ensure that our deaf students, if their parents select to go into e-learning, that you have enough interpreters to be able to fill those slots for the e-learning for our deaf students?
Through the chair, we're going to make every accommodation that we need to help our children. And if, openly, if we do not have as we look in starting to cut the data to determine accommodations, if we do not currently have the staff to serve, we will go hire the staff to serve, because we are professionally obligated to do so. Mr. McCauley, anything that you want to speak to this point?
Yeah, just to follow up, we are prepared to order, Mr. Farkas and his team is ordering a series of the face
Face
shields
guards, yeah.
for those kind of circumstances. And we also made very clear in our plan that any kind of instructional accommodation that a teacher needs to make in order to communicate with the kids would be allowed. So we will do that. Now, of course, as with everything, we are at the mercy of those who want to come and work. Interpreters, teachers, custodians, etc. So we will do everything we can to get that staff, but we are prepared for it.
Thank you, sir. Thank you.
Thank you. And I do believe Dr. Hahn asked to be taken out of the queue at this time, so we'll move on to Ms. Gray.
Thank you, Madam Chair. And first off, I want to say I appreciate your heartfelt concern for the brick and mortar and the choice. Everyone needs the choice. And I also appreciate your remark about if the virus goes up, then we may have to be fluid. And I think that's what we're really looking at, a fluid situation that we have to be able to pivot. And it's so remarkable that you know, we can share, agree to disagree, but always share the best ideas that will keep our students and our teachers safe. And talking about the teachers real quick, I just want to remark that because they are on the front lines and we're seeing, you know, the danger or possibility of them getting infected, when we talk about makeup days or 8 days, 5 days, I would ask Superintendent Davis if you would be definitely upfront, of course, with us board members, but to consider the waiver because of the risk situation, if nothing else, and the tenuous situations that many of them, as Member Snively said, must work. They must work, and what a trade-off that is in the face of possible danger. So, if we can please be more sympathetic and indulge our teachers to the nth degree. My question is real quick. So the buses, this is what I wanted to know. We're on the bus. Who's in charge of the social distancing on the bus? The bus driver has to drive. So what's that about?
Yes, ma'am. To the chair. It's openly impossible to do, and I'm just going to be honest with the board and the community. It's very difficult to do. If we were going to social distance on the bus, I said it last time, we would have to buy $190 million worth of buses. We need 2,000 additional buses, and that doesn't even cover the cost of employees and benefits, which is a total of $300 million to make that happen. So I mean, it's very complex and difficult. You know, right now with the way that we're going to be able to do it is due to the fact that a good portion and section of our community is electing e-learning. And by the way, while we're going to offer PPE and masks for every learner that decides to ride, you know, it's going to be very difficult for us to create that separation because, I mean, we're talking that some of the times we have, you know, 60 plus students that are on a bus. And but I can tell you I'm committed to, and Mr. Farkas and his team is committed to looking at every one of our routes. And as we start the year, I know we're going to have to make adjustments to be able to refine those adjustments. And if there's areas that we are not going to need to run, maybe pivot and make the adjustment to have a double loop and to have two buses come to a particular stop to create that. But openly, it's going to be very difficult to accomplish.
Yeah, and I appreciate that. And Member Snively and I both, we hang out in Dover in those migrant areas. Not we hang out, but we're there. Yeah. We're there, and we know that those spikes happen frequently, and they do depend on bus transportation. So I'm just remarking on that as a real critical. You know, we got to be very, 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 very careful. And Mr. Farkas, please share with the board, not right now, but how methodically you're going to handle bus riders in the face of especially those who depend on the buses. Thank you.
Can I say something to that? Yes, ma'am. Can I say something? Can I say something?
I'm sorry,
I'm
Mr.
sorry.
Davis.
I'm sorry. I
Mr. Ferguson.
didn't want to get through the chair. I didn't want to get in trouble. Just I know, but yeah. To that point, we're going to clean. I mean, we're going to clean the buses after every touch point for a child. So I want parents to feel comfortable that our staff is going to be trained and be prepared to be able to clean every seat and wipe it down, and we're ready to give all the necessary equipment we need to protect the learners while they're riding and after riding. We're ready to clean. So thank you. Sorry. Thank you, Ms. Schamberger.
Right. Thank you. And Dr. Hahn actually wanted to get back into the queue, so I will go ahead and call on Dr. Hahn if she is ready.
Yes, thank you. Can you hear me, or is it still low?
Sounds great.
Okay, on my end it's a little choppy, so that's why I'm always asking. I'm so sorry. So just, again, I'm going to just reiterate that a lot of our teachers don't have a choice to come back, but we are giving them a choice if there's a possibility. I guess my question, and Superintendent Davis, you and I spoke about this, and this is really just for my teachers to understand, because I've gotten a lot of teachers who have asked questions about how do I apply for e-learning or Hillsborough Virtual. Can you just talk a little bit about that? Because I know your staff is working on the process, but I think it might put a lot of people at ease who are thinking about that as an option. Thank you.
Yes, ma'am. Through the chair, we are working on this daily, and thank you for the partnership with Mr. Creed and also Ms. Baxter Jenkins to work and make sure we have the right criterion. But the declaration of intent, the intent to return form for the employees, we want you to select what you believe will be best for you. A, we're asking you if you are going to return, and B, we're asking, what is your next step? Will you be, do you want to return to brick and mortar? Do you want to return to e-learning? Are you attracted to Hillsborough Virtual? And we know that we may not have sufficient seats in e-learning and in Hillsborough Virtual. So we're going to have to build that criterion, and we're in the process of defining that. That may be it's going to be very fluid, but we're going to have to look at, what is the actual need from the school? What's the grade band? What's the certification need? And then we're going to have to look at overall hardships. We know that some of our employees are going, they personally may be vulnerable to this type of, infection and disease. So we want to make certain that we have a hardship, that they can apply for, and that's verified through a practitioner, through a medical practitioner that we can transition through, and then look at whether or not they're personally impacted. And then, after that wave, then we could potentially transition to someone that may be living with someone, caring with someone, to go to that tier, and then potentially transition to someone that just overall wants to, inspires to teach through that manner. All that has to be, through a collaboration, through bargaining, and to make certain that we are taking the right steps and to protect the working conditions of our adults. But, we see that a number of our teachers have identified that they want to transition and feel safest by transition to, whether it's coming back to school, going through e-learning, or Hillsborough Virtual. And we will be taking in consideration any potential exemptions they may need to provide to us.
Thank you. I know those choices are very important to our teachers. I just wanted them to hear a little bit about, that process and that opportunity. And just one last quick question around, our school buildings. We know that this is an airborne virus, and so a lot of the questions I've been getting and the concerns from constituents revolve around the HVAC systems. And so maybe somebody can talk a little bit about the precautions we're going to be taking around the HVAC systems. Thank you.
Yes, ma'am. Through the chair, I'm going to let Mr. Farkas address that one.
Thank you.
Yes, sir. We actually spent a lot of time. Had a call with the county commission with the staff from the county to look at the best solutions. In some of our new systems, there's a couple of different UCV and ionization that help with that. All of our current AC systems have a Mercate filter. Mercate is the type of filter we have. The recommendation, we'd like to upgrade and have a stronger filter. But in all transparency, the reality is that some of our systems are so old and antiquated that putting a stronger filter on them taxes the system. So doing ionization or doing UCV or doing UVC, is one of the options that we're looking at. We talked about putting them in our shelters, partnering with the county, make sure they'd help us pay that. That's not a done deal, so I don't mean to put the cart before the horse. But the reality is we're looking at a staging that area and see how we can do that. I'll be honest, as a parent and having a kid in one of the schools that will be here this fall, the reality is that how do we put them in 100 of our schools and not in 250 of them? So the staging and how we get those installed is obviously of grave concern to me, because I'm not sure how we justify that. And that part of it too. However, what we're doing, the process of doing right now, we have 2 different engineers because we want different opinions on what we're doing that are consulting with us and telling us if we did it, how we do it, how much it would cost. And then in turn, I'll bring that to Superintendent Davis and Dr. Kemp and talk about what that looks like from a planning standpoint. I mean, we want to be as safe as we possibly can, but there's a cost for each one of those. So looking for partners like the county, which we've already had a couple of conversations with, and looking at costing that out for a long-term discussion is definitely something we're in the midst of, not just one meeting. We've had a bunch of meetings, but want to ensure you that particle filters are on all our AC systems. They're MERC filters that are already on there, and we're looking actively at upgrading this.
Thank you. I'm glad to hear that you're working with engineers and others around this expertise. I do know my husband's an engineer. They have been, so I've talked to him about this, and I know that even simple things like maintaining the humidity levels at a higher level, because if the air is too dry, the virus can remain airborne longer. So even some of those tweaks to the system that may not be a big ticket item, but can have a big impact. So I'm glad, that's, again, it's all about safety and keeping kids and teachers as safe as possible as we move forward. So thank you. I appreciate it.
Thank you, Dr. Hahn. Member Stewart?
Thank you, and I'll just be brief. I'm just, Member Snively, I respect your opinion, and I was at that same meeting yesterday, and what I want to say is this isn't permanent. I'm not looking for us to stay in e-learning forever. This is temporary, and my graver concern is that we open schools for a week, for 2 weeks, and we're going to be in a situation where we don't have appropriate supervision, we don't have kids learning anything because we're going to have to shut down again. And I don't know that anyone's run the numbers on what that costs. But I just think it's a safer, better, more responsible plan for us to go straight to e-learning for 9 weeks. I'm not saying we can't offer something for families who need to go back to work. There are options out there for us to offer host. I haven't heard a thing about what host is going to look like in any of these situations, because we have a lot of employees who use host. While they're working, their children finish school and they go to host until they finish the workday, and I haven't heard anything about how that operation is going to run. I think there are options out there, but I'm concerned that as one of the largest employers in this community, we're going to expose the largest number of people, including children, to something that is not under control in this community. And so, again, I don't want us to play whack-a-mole here. The school district opens, then businesses start opening, and more businesses open, and government opens, and then all of a sudden the school district has to shut down, and then everyone is shut down again. What is the point in that? This virus is not flattening from the numbers that I'm looking at and the things that I'm seeing on multiple graphs. The American Academy of Pediatrics today pulled away from the White House, saying they don't agree that children need to be back in school right now, although there are detriments to children not being in school. I understand that. But life or death shouldn't be one of those detriments. So Superintendent, I would implore you and ask you to bring forward a recommendation at the next meeting to also have an option for us to move to e-learning. I know the legal team is probably going to have to figure out what that looks like so that we don't get penalized funding wise, but I don't think that we are in a position as the third largest district in this state to move forward on this. The other 2 large districts next to us are not doing it. We have no one to even say, hey, well, Miami-Dade did it this way, or Palm Beach did it this way, Broward did it this way, because they're moving to straight e-learning. And I understand they're under different requirements legally, but I think that we need to have that conversation. So if you would indulge me and bring that forward, I think this board has a vote in this and how we move forward. We need to be leaders on this, And unfortunately, I think the rest of the state and some of the people in this country are watching our actual newscast today. This actual workshop is being broadcast across the entire School Boards Association nationally today, because my colleagues knew that I was here today, and I told them I couldn't make our meeting today because this was more important work. So people are watching what Hillsborough County, the 7th largest district in the nation, does and how we open and what that looks like. And I think we responsibly need to do that as safely and effectively as we can for our community. Thank you.
Thank you, Member Stewart. Member Schamberger?
Thank you so much, Madam Chair. And I'll be brief because, as you can already tell, Member Stewart and I are keenly aligned. She actually hit on every point that I was going to bring up. So at the risk of sounding like a broken record, let me just briefly reiterate a couple of things. I do also respect your position, Member Snively. There is no better education method than brick and mortar, just in that in-person classroom, teacher, in-person instruction. We know that District 5, our most vulnerable students, certainly need that type of engagement, but we can only do that when we can guarantee that it's safe. And so I just want to reiterate, as Member Stewart did as well, Superintendent, I am asking you to bring back to this board the feasibility or not of e-learning for at least the first semester. That will include parent training and any opportunity we may have in this district to accommodate families who may need some type of child care or host and things like that. We know that continuity in our teacher pay is important. Continuity in staff pay is important. We know that continuity in education is even more important. And so to cycle back, to take the risk of opening and the next week closing again, I think is just senseless. And so we have a chance right now today to make the best decisions for our families. We cannot, as a district, afford to have the death of anybody on our hands because of making rash decisions. And so I hope that the board would consider that as well. But Mr. Superintendent, I look forward to that information from you, hopefully prior to the 23rd. Thank you.
Thank you, Member Schamberger. Member Gray?
Yeah, and not any of us board members want to say that we are diminishing the life and death equation here. We're all on the same page. The students, teachers, children, younger children are our first priority, as it is Superintendent Davis. I wanted to know one of the questions out of many, real quick. So if I'm in band or chorus, Superintendent Davis, how are we going to handle those type of classes where there's instruments being used? Now, I understand the physical education. Actually, they're just loving the sunshades. They're going to bring the kids outside, and, that's going to occur. How are we going to handle that situation? And next, Mr. Farkas or Superintendent Davis, I want to hear the accountability of the custodians. I know they're centralized, but how do we know? And they are critical right now. They're like the major players in keeping disinfecting practices. So who's keeping track of them? Are we going to put it onto the principal? Or who's, how is that being done? And this is not the most critical question, I know, but I just wanted those two, and then I'll be satisfied for right now. You first, Superintendent Davis? Band and chorus.
Yes, ma'am, through the chair. This is one of the questions that we are having conversations with Tampa General Hospital and USF Health. This is one of the indicators when we talk about not only with chorus, and we know that when you're singing, you're projecting potential issues related to what we can do, impact others negatively. So we're looking at having more conversations with them to give us guidance. They've given us a preliminary recommendations that they have sent this afternoon that we will look through, and we will have a plan for that prior to school started. I'm sorry I don't have an answer for that today, but it is a conversational piece that we are having. They did a really good job, pushing us about what we're going to do and providing guidelines to be able to make certain that those classrooms remain safe. And it's very hard because some of our course classrooms are let's be honest, there are 40, 50 kids in a chorus classroom because they're working as an ensemble, they're working to prepare. So we've got to make, it is very difficult to make certain they have the proper space in between, but we'll be able to look and have more conversations with our partnerships in order to make an informed decision. As it relates to your second question, I'll go ahead and let Mr. Farkas answer.
Actually, he said it is actually paramount to this conversation, Ms. Gray. I think that your question is very important to what we're doing. It's for, regardless of how we feel on both sides of this equation, or when we come back to school, custodial cleaning is going to be a huge part of the safety of what we do. I think we have a three-pronged approach. The first one is we've already been in conjunction with TGH and T-Pro that consulted. They want to see our checklist. They want to see our training for what we're doing for custodians so they can say and provide feedback on that. So having a consultation with medical professionals in Tampa is primary to what we do to set the tone. The second thing we've done is to actually do training. Because previously they reported to principals, there was a wide range and an eclectic group of training or lack of training that took place. Now that all custodians are going to receive the same training, that's going to be paramount to saying, hey, you've been given the expectation, we want you to meet that expectation. But that only goes so far as part 3, which is accountability. We actually have supervisors with technology that can go and take pictures, they can go and do quality assurance to ensure things are being done. We've shifted the supervisor hours to be in the afternoon and in the evening so they can go make sure that at night all those touch points are cleaned, take pictures, make sure that we have that. A lot of our custodians want to do the right thing. We have a very strong custodial staff, but we need to make sure we provide them the materials, the supports to make sure, and the training to make sure they can do it properly. So we look forward to training them and then making sure, holding them accountable to make sure they do that, because I think they'll step up. Most of our custodians have been here for years and years and done a great job, so we're excited to provide them the opportunity to be successful and lead that charge.
And thank you. And let's make sure they are seen to be very valued. I want to make sure that, because we all know that custodians are very valuable. Back to you. Sorry about that, Superintendent Davis, real quick. The reason I asked that question is not because I was in chorus when I was in high school, which I was, but is because we have schools that are dedicated to performing arts, such as Blake, and that's why I mean that's where a lot of that is coming from. And I will cease. Thank you.
Thank you, Member Gray. Member Perez?
Thank you, Madam Chair. As my fellow board members stated, Board Member Schamberger, that we have to set a precedence. You know, we are the 7th largest school district in the nation. And as Member Stewart stated, all eyes are on us. And, you know, if we lose a teacher because of COVID, that teacher can no longer teach. And if we lose a student because of COVID, that student can no longer learn. So where do we go from here? You know, how do we protect our teachers? How do we protect our students so that they, in fact, can progress, you know, with our students and our teachers can be protected. You have an incredible school reopening plan. You did an incredible job along with your staff. Let's be able to implement this plan with teachers and students that can benefit from it. And that's it. Thank you.
Thank you. And I think we're probably going to begin wrapping up. I think hopefully all board members have asked their questions that they're going to ask. And I have a question for Mr. Porter, but a couple statistics that were thrown out that I wanted to just make sure that the information that I'm going to give you is for Hillsborough County. And in Hillsborough County, 1,330 children from the age of 0 to 14 have been diagnosed positive with COVID, which is 0.00065 of the population. So I understand they're not in school, but I'm just telling you I don't know where you got the 1 out of 3 children, but I'd love to see that data source because I haven't seen anything of that magnitude. That would be 30% of children being diagnosed with COVID, and that we are nowhere near that as far as I know, at least in Hillsborough County. I don't know, I'd have to look up the state statistics by age unless you have that information, Mr. Superintendent, I don't know. But if you don't, that's okay.
Just have students.
Okay. So, and then I would also like to see from the American Academy of Pediatrics any rescission of their endorsement to send children back to school, because I'm looking at an article, albeit from the 10th of July, and it's a statement from the it is a statement from the American Academy of Pediatrics, the American Federation of Teachers, and the American National Education Association, which is a strong statement about sending children back to school in a safe manner. And so if that's been changed, I'd like to see that information as well. I haven't heard anything differently from the American Academy of Pediatrics. So the other thing I'd like to say, especially in our county, emergency visits are down, new cases have flattened, and the percentage of positivity testing is also down in this county. And so, again, I'm not going to belabor the points that I made a little earlier, but I do strongly believe that we still need to give our children an option. And the question I would ask Mr. Porter at this point would be, you have a couple of my colleagues here who have asked the superintendent to come up with another plan. We haven't voted on any plan yet. And so would we need to vote on this plan first before we ask him to come up with another plan? Because that's a lot of work to come up with an entirely new plan if we haven't even voted on this current plan that has taken a lot of time and effort to put together. So what is your recommendation on that?
Thank you, Madam Chair. So today's workshop was fulfilled its purpose. It was to allow the superintendent and his team to present to the board a reopening plan and for the board to give feedback to the superintendent. That's exactly what's happened. There is no vote anticipated today, and a vote would not be appropriate, as a matter of fact. So I think the superintendent needs to take all the information, all the input from all of you, and come back for the special call board meeting on the 23rd with a recommendation. Superintendent's job is to make a recommendation. The board is to vote. And we'll take all the input that you've given him, as well as input from other sources, and then make a recommendation. And the board will vote at that point, and then we'll proceed based on the vote.
Excuse me. Thank you, Mr. Porter. And so just to reiterate, that is next week, next Thursday at 3 p.m., a special called board meeting. And that would be to vote on the reopening plan, as well as the calendar proposal that you are recommending to the board as well. And I'm assuming we'll see what a brand new calendar the entire academic year would look like based on pushing the start of school back for 2 weeks. Is that correct?
Yes, ma'am, through the chair, that's correct. We had some shell calendars, but we want to make sure we respect the calendar committee. We'll be able to meet with them Monday, and also the bargaining unit along the way.
And when do you plan to meet with the bargaining unit?
As of now, hoping, I believe, Monday. Fingers crossed.
Just because I think the board would like to see the calendar before the, the meeting, obviously, if we can, the soonest we can see it beforehand in order to give our feedback and maybe hear from our constituents. Mr. Porter?
The other thing I'll throw out, and I don't want to create any confusion, the special call board meeting was established yesterday because things are moving very quickly. Superintendent felt that he needed to get some guidance from the board about the start date, and sooner was better. There's also the option to not vote on this until the 28th, and we can talk about that. And again, I don't want to create confusion in the community, but if the superintendent feels he needs more time based on the workshop today, then that's something that can be done up until the last minute, and that's something we can work on. But I just wanted to put that out there as a possible option. If you felt you weren't ready to come back based on changing circumstances, we still have the option of coming back on the 28th of July because that's already scheduled as a regular board meeting.
It is, and I like to allow the public to know that there's a reason we can't vote today, and maybe you can explain that as well, because there are some requirements for public notice, and so people are asking, well, why aren't we making a decision today?
Yeah, let's be very clear about that. So under the board's rules and under the way the law is structured, this was noticed as a workshop. Your workshop is by definition an opportunity for you to receive information from your staff and to discuss things as a board. No vote was anticipated because it wasn't advertised as such. Votes are taken at board meetings, not at workshops, so it would not be legally appropriate for you to vote today. It wasn't advertised for a vote, and the expectation is it will be voted on at a meeting that was properly noticed. So it was never intended that the board would vote today, and again, a vote would not be appropriate today.
Thank you for explaining that or clarifying that, just for the folks who are watching and wondering why we're not taking any votes today. So, and then I think Ms. Stewart has one more comment.
Yes, I just wanted to, I know we said the CTA is meeting with the superintendent on Monday, and the calendar committee is meeting, but our Citizen Advisory Committee has also requested a meeting for Monday. So my two appointees reached out to me and asked if they could actually have a look at this plan and make some recommendations. I know that that's something typically that they would do in their regular meetings, so they don't meet over the summer. So they have also called a special meeting for Monday. So I hope that we can get their feedback at the dais before our meeting on Thursday. So.
The other concern I had, Mr. Superintendent, was, and something that Mr. Porter mentioned that made me think of it, is the fact that we could go all the way to July 28th. However, we are asking our parents to complete their declaration of intent. Is it now the new date is the 19th? Is that the new date? Or what's the new date for the declaration?
Yes, ma'am, the 19th through the chair.
Well, that's what I wanted to know, because we're not voting on anything until the 23rd.
Yes, the issue is for us to be able to identify staff allocations. We need to be able to work master schedules to be able to place teachers in a right location to be able to service children. So every day that we push out from a student declaration of intent, which has been out there for 3 weeks, and I know they wanted more information, and this plan is going to do a lot. It's every day that we miss to be able to work with principals who have great angst about refining their schedule. Mr. Connor, anything to that point?
I think you've covered it mostly. If there's any delay, it will make it a little more of a challenge for us to create the master schedule so that we can have the smoothest start as possible. We want to identify our teachers as quickly as possible, figure out their certifications, what the students are requesting for what model, so that we can have as smooth a start as possible. So.
So I guess the only concern I have is if someone changes their mind after they hear that we are going to, whatever the board decides to do, push back the start date or do e-learning or brick and mortar, what are they able to go back and change their declaration? And do you anticipate, how many people or percentage of people do you anticipate? I'm guessing you already kind of projected that to happen.
Through the chair, yes, ma'am. It may happen, but we will, right now we'll have a good basis of of information to be able to kind of forecast and build. So at that time, after the board votes on the 23rd, they want to make adjustments. We'll work with them at the school level to make those refinements along the way.
Okay, very good.
Yes, ma'am.
Very good. Thank you.
Good point.
Okay, I think that concludes all of our comments and questions for you today, Mr. Superintendent. Thank you very much again for providing this thorough presentation. I know it's very difficult to answer every single question that could possibly come up, every scenario. I know that there's a certain degree that you just have to make a decision about something when it actually happens, or try and anticipate something, before it happens if possible. But again, I have asked the community for grace during this process and patience, because it does continue to be very fluid. But I have noticed that you and your staff have been very nimble and very flexible, and we appreciate that, and we appreciate all of the responsiveness coming from you and your staff, because we are all getting contacted very, very regularly, multiple times a day, multiple different sources from our constituency, and we feel very obligated to try and make sure that we are listening to our constituents as well as answering their as many questions as we can. So thank you very much for the diligent work that you and your team have done, and we will look forward to meeting next Thursday at 3 o'clock to have our special called board meeting, which will also be televised. It will be a public meeting. Will there be public comment at this special called board workshop? Meeting.
Because the board is voting, the law requires that you allow public comment. So you'll be following the protocols of a normal board meeting. And you can set time limits on that. And the anticipated time for the meeting is 2 hours. And so public comment can be, will be at the beginning, but we can talk about that at the time of the meeting.
Okay, so so public comment will happen at the special called board meeting if people want to sign up to speak, and we can cross that bridge depending on how many folks decide to come and speak that day. So very good. Board members, are there any other? Is there any other comments or questions before we adjourn this workshop? Then we will go ahead and officially adjourn. Thank you again.
Thank you.